As doctors, we trade in information. Information about a patient's symptoms, history, diagnosis, about the chances that a patient will one day be healed. When a new patient enters our lives, the information we need remains trapped in the unknown. So we ask questions, we order tests, we watch, we feel, and we listen. We spend entire careers beating back uncertainty, peering into the darkness for the glimmer of knowledge that will lead to a diagnosis or a cure. Eventually, we get used to the unknown. We've dealt with it before. We greet it like an old enemy, armed with our familiar arsenal of scans, needles, and questions. Day after day, week after week, across hundreds and thousands of patients, we become accustomed to lacking the information we need to do our jobs, accustomed to searching for that information ourselves. And that's when we forget that sometimes the most dangerous information isn't what we don't know, it's what we do. So do you remember what we talked about?
Yeah.
And so now we know where not to put Legos?
Yeah.
Alright, we can go out. The exit's this way, your parents are waiting for you out there.
Dr. Hemsworth? Paging Dr. Hemsworth. You're needed in emergency room 2.
What took you so goddamn long?
Hey.
She's been like this all morning. She just woke up like it.
How are you feeling right now?
I can't really breathe, and I feel really cold.
Well, what are you gonna do?
We're gonna get you checked out, okay? Yeah, so it looks like she has pneumonia. She's not satting too well. Her fever's 104, so I'm gonna try to get her a chest x-ray and get a sputum sample, and then we're gonna get this all sorted out. In the meantime, I'm gonna put this oxygen mask on you, and that should help for the time being.
Hey, hold up a second. Before you go in there, I thought you ought to know. My daughter has AIDS. The mom's not in the picture. Thought you ought to know that.
I'm so sorry to hear that. I mean, you know that AIDS is a pretty big deal, and pneumonia is even, if that's what she has, her prognosis doesn't look too good.
Her pediatrician told me we had 6 months. That was a while back, so.
You should probably start planning for that.
Well, one more thing. She doesn't know she has AIDS. I'd like to keep it that way.
Oh, I mean, don't you think that it might be worth it to tell her? I mean, there are doctors here who specialize in end-of-life care. Talking to one of them could really help.
Look, she's 12. She doesn't even understand what it is to be an adult. If you were dying, you want to keep it that way, right? Where you're happy, you're safe. So, do me this favor.
Hey, how you holding up in here?
I feel a little better. I think the mask is helping. Do you think I'll be able to go home soon? I've hated feeling so sick and tired lately, and I really want to get back for soccer season. I'm gonna get to play soccer again, won't I?
Gotta go check on those tests. I'll be back.
You're gonna be just fine.
You've reached an age when you've learned a thing or two. An age when your sweat smells like leather and tobacco. So why would you let something like erectile dysfunction get in your way? Isn't it time you talk to your doctor about Viagra? 20 million men already have. Ask your doctor if your heart is healthy enough for sex. I mean, we both know that it is. But ask your doctor. Do not take Viagra if you take nitrates for chest pain. Side effects may include headache, flushing, upset stomach, and abnormal vision. To avoid long-term injury, seek immediate medical help for an erection lasting longer than 4 hours. This is the age of taking action. Talk to your doctor to see if Viagra is right for you.
I should just tell the kid that she has AIDS, right?
What are we talking about?
I mean, I just feel like if she's gonna die anyway, she should know what she has.
I don't know. There are serious consequences to that kind of stuff. Like, what if a kid can't take it? and just goes crazy. Or, what if the dad stops coming with any of his family members to this hospital? There are like 3 of those guys that have AIDS. We can't afford to have all of them stop coming.
All I'm saying is, if it weren't a kid, I would want to tell her.
Does she even know what AIDS is?
Wouldn't surprise me. She seems a lot older than her age.
Just get an ethics consult, dude.
Wait, we do those?
Yeah, I use them like twice a week. Medical school doesn't teach you anything about moral choices, so that's why we have people who do it for us.
If I have to hear about how you went to Yale Medical School one more time, I'm going to stab you with this fork.
So, how do I get an ethics consult?
Nobody knows where they are because they're in the most hidden offices on this hospital campus. But if you go now, you could probably make it before grand rounds. Here's a map.
Thanks.
I went to Yale.
We've been awaiting you, Doctor. This AIDS case is a fascinating debacle.
How did you know?
We know everything that goes on at this hospital. Please, have a seat. After careful consideration of the case, the facts, consulting the magic 8-ball, it is our professional opinion that you should not tell the child that she has AIDS. Bullshit!
God must be shaking in his poorly constructed grave. Not give the girl the name of the disease that will kill her?
The dad is the only adult in the patient's life. If we break the trust between the dad and the child, we could be looking at a crisis of trust.
A crisis of trust? What if the girl finds out? What about the crisis of trust between her and her father?
Whoa, hang on a second. Can we all just take a quick deep breath here?
Commensurate with her development, she's 9.
She's 12.
Cecilla Buck.
Utilitarianism. There's too much at risk for harm here.
It is the person who has the most at stake for the outcome, not the person with the best argument for their position, whose position we should honor.
Shit, I've got to go. I don't have time for philosophy. Whoa, what happened? I thought she was stable.
It's really hard to breathe.
Some bullshit medical thing.
Oh my god. Oh god, she's coding. We need to start CPR
We
right
need
now.
a crash cart in here!
How long does she have?
Weeks, maybe a month or 2. Look, it's getting close to the end. It's time to tell her.
She's just a kid. She doesn't even know how to be an adult. If we told her, it would ruin the last 2 weeks she has. The last 2 weeks we have. And I won't do that.
Look, right now she's sitting in that hospital room, confused, terrified, and in a lot of pain. She was dead for a full 2 minutes. She knows something's wrong.
And you don't think I know that? This is a parent's worst nightmare. And I'm not going to let you remove the last scrap of hope she has so you can get away with your clean goddamn conscience.
I'm sorry, Mr. Daniels, but if you won't tell her, I will. She deserves better than shallow lies.
Get out. If you come near my daughter one more time, I will sue you and this hospital. Just get out!
Dr. Hemsworth, I thought I might find you here. I just spoke with one of your patient's parents, Mr. Daniels. He seemed quite upset.
That man is blatantly lying to his daughter. She coded earlier today, and he still refuses to let her know what's going on. I know she's 12, but she deserves to know.
Dr. Hemsworth, legally speaking, this case is not open for debate. Look, you getting anywhere near this patient and communicating what you're trying to say opens the hospital to liability. We could face a lawsuit over this.
This is just the hospital covering its ass. Doesn't the patient deserve to have the best care she can?
Hey, you're too close to this. You're off the case.
Give him the finger.
Hey!
Hey, Jackie. I was just coming in here to make sure you were doing okay and everything.
I don't feel so good. I feel like something bad is gonna happen.
Well, everyone in this hospital really loves you, and we're gonna try to take care of you as much as possible. I'm just coming in here to tell you that unfortunately, I'm not gonna be your doctor anymore. But I know that there are gonna be really great people taking care of you. I know they're gonna do a really great job.
Dr. Hemsworth,
Yeah, Jackie.
am I gonna die?
Well,
Because if I am, I want a chance to tell my dad and my friends that I love them, say goodbye.
here's the thing, Jackie. Oh shit, can we get some help in here?
First case for the afternoon is a 12-year-old female with HIV and AIDS. Patient came in presenting with pneumonia secondary to a respiratory infection. Patient died 48 hours after entering this hospital. Dr. Hemsworth, I think this is your patient. Do you want to walk us through this case?
Next up on the floor, we have Dr. Deirdre Farron. Dr. Farron is a pediatric emergency medicine physician at Hasbro Children's Hospital. She'll be dancing with David, and they will be doing the West Coast Swing.
Sun shines most of the time, and the feeling is laid back. Palm trees grow, rents are low, but keep thinking about making my way back. Well, I'm New York City born and raised, but nowadays I'm lost between two shores. LA's fine, but it ain't home. New York's home, but it ain't mine no more. I am myself to no one there, and no one heard at all, not even the chair. My cry, I am the sinner, and I am lost, and I can't even say why. Leaving me lonely still. Did you ever read about a frog who dreamed of being a king and then became one? Well, except for the names and a few other changes, if you talk about me, the story's the same one. But I got an emptiness deep inside that I've tried, but it won't let me go. And I'm not a man who likes to swear, but I'll never care for the sound of being alone. I said, cry.